Anyway, from today, prescriptions for 7 conditions. I don't know why I'm chuckling, because they're not funny conditions. There's just something about having to go to a pharmacy and describe your ailments in front of a queue of random people if they don't have the private rooms. I don't know why, it just makes me like, ooh, a little bit. Anyway, this is happening now in England. You wouldn't have to go and see the doctor. You'd be able to get, for example, things like antibiotics from that pharmacist. Apparently, it's going to free up 10 million GP appointments. They're there or thereabouts. Are you a fan of this, Jacqueline?
I don't know why we haven't done it before. If you're on the continent and you need an antibiotic, you go and see the pharmacist. They will have a good chat with you. And so you not necessarily needed a prescription to get a drug from a pharmacist. And our pharmacists, I think, are trained very well. They know more about the drugs that they actually pop over the counter than doctor friends of mine. So they know far more about all of this than us. I have a flu jab normally. When I get a flu jab, I go to the chemist, just make an appointment because it's so easy to do. And equally, they're not going to be handing any of these drugs out sort of willy-nilly. The pharmacist, they do have a chat. And most people, they'll go to the pharmacist now with an ailment and he or she might say, well, look, you should see a GP. Or they'll say, well, actually, let's try this. We've got this over the counter. But that brings me then to the drugs that we actually make sure that you have a prescription for. There are drugs, some of these that are, that outline these ailments, and they should not necessarily be on prescription. It should be, the pharmacist should be allowed to sell them.
Yeah. And by the way,
it's the pharmacist that actually determines that that's what you need.
And to be clear, Scotland, Wales and Northern Ireland, they have already been doing this. So why on earth it's taken England so long to catch up is beyond me.
Well, I agree with Jackie absolutely that why haven't we done this before? But I also think that you're right, that it's. I think we need to make sure that our pharmacists have the capacity to do this. I mean, I have to say, my local pharmacy, the treatment room has actually got boxes in it. So I hope they clear the boxes out if they're going to be prescribing more treatments, because I don't want to be standing there while people using, the people coming in for their methadone, which it also dishes out, describing my my ailments. So I think, yes, we need to see. It's a great idea, pharmacists step up, but we need to make sure that they introduce new ways of doing it, because I don't want to be standing in the middle of the pharmacy talking about my problems.
There'll be some sweeteners to help enable people, pharmacists, to do this, because apparently they'll get £2,000 each. They'll get £15 per consultation, plus £1,000 a month if they see a minimum number of patients as well. So I've got to say, the incentive
to get the boxes out of the treatment room.
Boxes shifted out of that treatment room. I can see them. And they'll be having the Chuckle Brothers from me to you, from me to you, that have been doing it quite some time.
They do it now, the ones that do the jabs.
Yes.
Because they get paid a fee. Obviously for the COVID or whatever.
Totally, yeah.
And so they clear the boxes out.
I mean, I get conjunctivitis a lot. It used to be ridiculous that you used to have to go to a GP who'd see you for 15 seconds, look at your eyes, say you've got it, and send you send you with a prescription. Totally sensibly, about a decade ago or more, the same medication the pharmacist can prescribe. So we've got sensible history on this. As you say, why didn't it happen before?
I wonder, like, when you look at the GP's workload, I noticed this story, I think it was in France, about these robots. They've been using these robots there to help people in a healthcare setting. I'm going to show it to you on the screen. I mean, I don't know why, when I see these kind of robots that are made to look like humans, there's something about them that freak me out a little bit. Anyway, it's all about helping patients, elderly perhaps, in hospitals with their form fillings and some of their testing and whatever. Is that our future?
Well, I mean, I think this is a long way off this being rolled out, but I think that certainly the healthcare system needs to embrace tech more where it's appropriate. I mean, the NHS is still the only user in the country of fax machines, which sort of depresses me hugely. So I think yes to tech where it works, no to depersonalising the system, and I think it'll be a while since we get those robots.
Would you be a fan of those robots, Jacqueline?
To a degree, I certainly would. And, of course, those that need help in the home. I mean, have a robot, make sure it cooks your dinner, make sure it does the washing and ironing. They need to make sure it's programmed properly. I mean, it won't literally do all of that. But when you've got people who need a bit of care, they need a bit of assistance, and they will maybe only have a carer come in once a day or something. I mean, this is where technology can work really well.
Why don't we use robot hoovers? I mean, I have to say, first robot hoover I ever saw was at the house of a GB News presenter who was shouting at it for not doing a good enough job. She better remain nameless.
I wonder which GB News presenter has got one of the... I can tell you now, I got it from my partner, actually, as a present for his birthday, and he was livid. It was a hoover and a mopper all in one.
Oh,
but
dual.
Yeah, but it left the floor soaking wet, so I sent it back. Long story short, the company offered me a free replacement, and then I got freaked out because I thought, why are you offering me a free Hoover? And then I was convinced that it was a Chinese Spark, this Hoover. So I was like, thank you very much.
Yeah.
No, thank you. So it never...
But this GB News presenter was being very firm with the robot Hoover that it wasn't doing a good enough job.
Oh, well, there you go. You can all put your thinking caps on and wonder which GB News presenter, female presenter, kicks off a robot Hoover. I can assure you it's definitely not me. Anyway, you know, company. What about company for the elderly? Well, not just elderly, lonely people. AI and robots and all the rest of it. That could be a good use for them, couldn't it?
Yeah.